With aging, a lot of women develop weakness of the pelvic floor, which often results in pelvic organ prolapse, whether it's bladder, the uterus, or the rectum, the posterior wall. And that can be repaired surgically in many cases and can improve the quality of life for patients significantly. Unfortunately, from what we know about pelvic organ prolapse, it's largely associated with genetics as well as birth injuries and trauma, as well as just having children in general. Constipation is something that patients can work on throughout their lifetime if they're prone to it, to help avoid posterior prolapse specifically. The symptoms of pelvic organ prolapse include feeling a bulge or pressure and discomfort with activity that often improves when patients are laying down. The general evaluation for pelvic organ prolapse includes an office visit with a discussion of symptoms that are most bothersome to the patient. That is usually followed by a pelvic floor exam, where we have patients Valsalva or strain during the exam. Usually we do that laying down, but sometimes we will also do it standing up to get the full extent of the pelvic organ prolapse that they deal with on a day-to-day basis. Based on that evaluation, different treatment options can be recommended, including vaginal surgery or robotic surgery. Pelvic floor physical therapy can be very helpful in strengthening the muscles of the pelvic floor. Additionally, pessaries can be used to manage pelvic organ prolapse, which allows patients for a non-surgical, durable option. There's different kinds of pessaries that can be used, and they are generally placed, the patient is generally fitted for a pessary during their office visit, and when they go home, they are able to manage the pessary themselves, and for those patients who are not able to do so, they can return to the office for routine changes and cleaning.